Begin.
Hi, my name is Lydia and I'm the student pharmacist. I'll be going over your medication with you. How are you today?
Good, how are you?
Good, thank you. Okay, let me just start off with some of your basic information just to confirm. May I confirm your name, please?
Jade Doe.
Thank you so much. And I have an address on 1234 Wonderland Lane in Amarillo, Texas. Is that still correct?
Yes, ma'am.
Okay. And a phone number of 555-555-5555. Is that good?
Yes.
And lastly, is the date of birth 12/11/57?
Yes.
Okay, wonderful. So I see that you are getting a Lenjonate today, correct? What was your diagnosis for it?
Osteoporosis.
Excellent, okay. So this medication is a little bit unique. You take it only once per week.
Okay.
It's 70 milligrams, and the doctor currently has you taking 4 tablets, and then you'll have 5 refills. Usually this medication is taken with a full glass of water, 6 to 8 ounces, and you want to remain in an upright position when you're taking it. And make sure that you take it first thing in the morning before any meals, at least 30 minutes. So never at bedtime or you're about to lay down. And then you want to follow again with about 2 more ounces of water after you've taken the medication. And just go ahead and remain in that upright position for about 30 minutes after you take the medicine before lying down or anything of that sort. Also make sure that you do not chew or swallow or break the tablet, swallow it as a whole. That's because it has a tendency to cause ulcers, and if you break it, that may worsen the side effects.
Okay.
Some of the other side effects you may commonly experience would be abdominal pain, just upset GI. Some have reported headaches and maybe a slight fever. That's very typical. However, if you do notice any excessive and unbearable joint pain or bone pain, anything of that sort, excessive ulceration or bleeding in your throat, go ahead and contact your doctor immediately, and if it's a very severe case, go ahead and go to the ER.
Okay.
Those are basically the main side effects. What questions do you have for me thus far?
None yet.
Okay. And just to confirm, what allergies do you have?
No
to
allergies.
medications? Okay. And what are your other medications that you're on right now?
I'm also on ibuprofen and Tylenol just as needed, and then a multivitamin.
Okay. And I see some blood pressure medication as well, like Citalopram. There should not be any issues with that, but just be careful about taking your medication. If you notice anything unusual, feel free to go ahead and contact your doctor or myself.
Okay.
I'll go ahead and follow up with you in about 48 hours.
Okay.
See if you have any questions or concerns. Meanwhile, if you have any other questions, don't hesitate to let me know.
Okay.
Okay? You have
Thank
a wonderful
you.
day.
Thanks.
Thank you.